Terrific to see a day of no cases in Victoria, no locally acquired cases, one in hotel quarantine. And as the Acting Premier said, huge thanks to all of those, especially involved in testing, those who come for testing, really every Victorian who's thought about their symptoms and gone and got tested at the very first sign, all of the path labs that are doing that testing in huge numbers still, and all of the testing site staff, as well as the hospital staff who continue to care for the few patients who are in hospital. But the week ahead probably won't be all zeros. We've still got thousands of primary close contacts, some of whom may well become positive. That's not a concern as they quarantine for their entire period. But it's only been 48 hours since we've had cases of uncertain acquisition. So the family that have travelled to Queensland and the Reservoir household are both still under investigation for exactly how it might have been acquired. So that's a real lesson that we may yet see cases. There's still lots of investigation to go and a really strong reason for everyone with symptoms to get tested, because you might be part of those unknown chains of transmission. So we really do need to keep our efforts up. All of those things that are still in place in Victoria are part of those efforts, including wearing masks indoors and out. They are measures that work to reduce transmission, to reduce the opportunities for contact with others. We do nonetheless continue to release a number of primary close contacts, especially as they receive their negative day 13 test, complete their 14 days of quarantine and go about their lives. We, as of yesterday, had 4,300 primary close contacts, having cleared another 900. So we're working through those bit by bit. They've all been staying home, doing the right thing, and my huge thanks to them. Yesterday, the public health teams continued the rapid response to the new Reservoir household outbreak. 4 household contacts have tested positive, no clear acquisition source as yet. Obviously, in terms of managing those cases, their primary and secondary close contacts have been identified. Some of the critical primary close contacts have already been tested and tested negative, but we, again, need to look as to where they might have acquired their infection and keep investigating all of those close contacts. The genomic sequencing's come back for that family, and it does suggest a Kappa variant, so it's consistent with the city of Whittlesea and Port Melbourne and aged care cases all being of that variant. Following interviews with the positive cases, there are a number of potential exposure sites, but also acquisition sites, so where they might have been when another infectious case was. So please go to the website through the course of today. It'll be continuously updated just to see if any of those most recently added exposure sites apply to you and act accordingly. There will be some blood testing done for some of those cases as well to try and determine really how far into their infection they are, again, when it most likely began for some of those cases, to help us investigate exactly when it's been transmitted and where. We're also obviously looking into the source of exposure for the 2 Queensland cases. Following long interviews by the Queensland health authorities and New South Wales health authorities, they've also gone through a really long interview process with us. We do thank them for that. It's a tiring process, lots and lots of detail around where they've been. We are looking quite a bit earlier than the 1st of June again for that acquisition, for where they might have picked it up. Whether or not they were infectious through that whole period is difficult to say. It does seem to be that they were right at the end of an infectious period when they've been tested in Queensland. So we have to go back some days to try and determine where they picked it up. But like the Reservoir household, the variant of concern appears to be the Kappa variant for these cases as well. Additionally, we've had several new wastewater detections recently. You'd be aware of those found in Bendigo, but we've also yesterday had detections in the Glenroy and Pascoe Vale area and some eastern suburbs in Whitehorse, Manningham and Monash. So again, a call out to all of those who are symptomatic across Victoria, but particularly for those areas with wastewater detections. And it really is those high testing numbers that will not only identify anyone who's not been identified as a primary close contact, who might be one of those cases who's had casual contact with somebody else who isn't aware that they've been exposed and who might be carrying the coronavirus. So terrific testing numbers, but we must maintain them. We're kind of at the halfway point in many respects. A day of zero is terrific. We've got a lot to run for all of those primary close contacts, all of those potential chains of transmission to be run down. So please bear in mind. And there are many people who've been tested, who've gotten over an illness, and of course we're in winter, who've developed symptoms again. So if it's a worsening of some normal symptoms, if you've had symptoms resolve, but again you've got upper respiratory tract infection symptoms, sore throat, runny nose, cough, fever, you really must get tested again. We will all go through winter as Victorians, probably needing to test once or twice or 3 times. That is the only way we can be sure we know where coronavirus is and to run it out of the state. In the long term, vaccination is our key. Having 20,000 people getting vaccinated through our state-run vaccination centres, absolutely fantastic. At least that many through our GPs every day. 50,000 people per day getting vaccinated in Victoria is absolutely fantastic, and the higher and higher coverage we get, the better off we are, and it is our long-term way out of this. Thanks so much.